How to Extract Data from a Predetermined Dataset by Jessie Lynn Gillespie, Amanda Gruen, Carrie Noonan, and Marissa Wood. What is data? Data can be primary or secondary. Primary data is first-hand data collected by the researcher for the purpose of a specific project. Secondary data is collected by someone else in a previous study. Secondary data may be more efficient and less expensive than collecting primary data, but it could be incomplete or difficult to validate. Secondary data can be obtained from data sources, such as electronic health records, which may include patient demographics, notes, medical problems, medications, vital signs, past medical history, assessment of health status, care plans, immunization records, labs, or radiology results. Health risk assessments may include information on chronic conditions, cancer risk, family history, nutritional status, fitness level, stress level, mental health, substance abuse, safety risks, or preventative exams. Administrative claims data can contain information that's submitted on a bill to a payer of healthcare benefits for medical services. So this could be government, CMS, or a third party. Administrative pharmacy claims data could include patient demographics, prescriptions filled, the fill date, prescribing physician, pharmacy filling the script, NDC codes, days of supply, or cost. Billing data is the data that exists from the one receiving services from the provider, organization, or pharmacy that is doing the billing. Laboratory vendor data may include patient demographics, date of test, type of test, health plan enrollment or payer, ordering physician, diagnosis for the test, type of test, industry standard logical observation identifiers, names and codes to identify the results of the test, accepted ranges for the result, and an indicator of an abnormal result. Device monitoring data could include cardiac and vital sign devices, web case and personal devices such as weight scales, blood pressure cuffs, or smartphone health monitoring application. The sources could vary. Health information exchange may include participating healthcare provider organizations, insurance companies, labs, public health departments, and hospitals. And finally, the most common type are research databases. They may include national averages for specific health and nutritional factors, identify state-level trends in chronic conditions or behaviors related to health. Examples of databases include healthdata.gov, the CDC, data.medicare.gov, the Food and Drug Administration, and CMS.gov. According to Saba and McCormick, there are 4 important factors when examining data in a database: the data naming and schemes, size and complexity of the data, the type of data, and the search methodology. Data in databases can be conceptual or computer-based. An example of conceptual data is a lab producing lab data. Computer-based data contains alphanumeric data such as numbers that can be added or subtracted. And database management systems are used to input, store, modify, process, and access the data. Now that we know what secondary data is, how do we obtain it? Make a data dictionary to serve as your guide. A data dictionary is a way to collect names and definitions being used in the project. This will include the format and variables required for this study and will provide guidance. Data dictionaries are useful in avoiding inconsistencies and make data easier to analyze. You may not be able to obtain all necessary data from one source, so you may need to link multiple data sets. Just make sure the units of measurement used in each data set are the same. A great deal of data can be downloaded from the internet, or it can be requested from a specific organization. When requesting data, it is important to understand each organization's process and obtain permission as necessary. Next, we will discuss quality and completeness of data. Is the data reliable? Reliability is determined by how consistent the data collection tool is. Is it continually measuring what it's supposed to measure? Is the data valid? Validity is the extent to which the collection tool is able to measure the correct data. This can be more difficult when measuring emotions or feelings. But often you will find that reliability and validity of a study's collection tool have already been published. For your reference, our textbook discusses a traditional approach for extracting data from databases, involving knowledge discovery and data mining. There are 7 steps to this process: task analysis, data selection, data cleaning, data transformation, data mining, pattern interpretation and evaluation, and finally deployment. For the purpose of our presentation, we chose an example question. For the year 2015, which state has the highest death rate amongst all ages related to drug overdoses?
So we decided to use the health.gov database to search our capstone question. So we went to the website and clicked databases, and in the search bar, we typed in drug overdose. This produced 15 results. So scrolling through these results, none of them really looked relevant to our capstone question. So we decided to reword our search to drug mortality, which produced 21 results. Looking through these, we found a data set named Drug Poisoning Mortality by State in the United States. This study was conducted by the CDC. Scrolling to the bottom, you see that there are different file extensions that you can open the data set up through. We didn't really know what any of these meant, so we searched what CSV stood for. It stands for comma separated values, and a CSV is commonly used for storing spreadsheet data, such as in Excel. So we clicked on this extension, and it opened a data set straight up in Excel. This data set was kind of overwhelming to look at, so we're filtering it out a little bit. We know that we only want the year 2015 based on our capstone question, so we unclicked all of the years besides 2015. Since we wanted to know information on each state individually, we unclicked the United States and left each individual state clicked. Because we want to know the state with the highest death rate, we decide to filter the deaths from ascending to descending, so it puts the highest rate at the top. So this leaves us with a lot of data that we don't need still. So we highlighted all of the data that we aren't using, and we hit it, leaving state, the year 2015, both genders, all ages, deaths, and population. This gave us a data set that was much easier to read and digest. And from this, we were able to see that in the year 2015, California was at the top of the data set. So in conclusion, based on our capstone question, for the year 2015, which state has the highest death rate amongst all ages related to drug overdoses? And we found, based on the data set, that California had the highest rate of 4,659 deaths per 100,000 population. It should also be noted that California is the largest state, or the state with the largest population of all of the data. So to recap, when we started researching our data set for our capstone question, we didn't initially set out looking to follow the 7 steps specifically. But looking back over our process, we definitely did follow all 7 steps of task analysis, data selection, data cleaning, data transformation, data mining, pattern interpretation and evaluation, and deployment. That concludes our presentation. If you guys have any questions, please let us know.